The point of cancer treatment is to cause inflammation. We want to induce inflammation through chemotherapy, radiation, even surgery sometimes, certain medications, immunotherapy. A lot of the goals of these treatments is to cause inflammation in order to kill the cancer cells. And it's definitely the right time and the place. We do want to kill the cancer cells, and until we get something better than these therapies, this is what we've got. So these treatments are going to cause inflammation to kill cancer cells, and then we just expect the body to be able to turn that off afterward. When I just discussed how turning off inflammation is often a problem leading to chronic inflammation, causing people to develop cancer. So if we're not supporting someone during treatment to turn that inflammation off and help it to not go too past the point of killing these cancer cells, and especially after treatment, if we're not helping people to rebuild their bodies back up with appropriate building blocks and nutrients and whatever it takes to help that inflammation to resolve, we're just causing people to jump from having cancer to potentially setting them up for cancer again down the road. All right, just really quickly, before I get into the episode for today, I want to let you all know that I am holding my Bloodwork Clarity Live Bootcamp. It is happening very soon in January, the 22nd, 23rd, 26th, and 27th. There will be some replays as well, so if you can't attend those sessions those days, and that's all right, we've got replay available. And just so you know a little bit more about what's going on, this is something I hold twice a year, and I want to teach people how to dive deeper into their blood work so that they can start to explore more. Where do you need to focus and what are some changes you need to make? Because we have data that can tell us that a lot of the time. And also, if you do your blood work, go a little bit deeper than just a standard conventional treatment protocols where they just look at CBCs, liver, kidney function. And instead, we dive deeper into nutrient markers and inflammatory markers and blood sugar regulation. Then we can also see what might look good sometimes and stop having a lot of fear around food or not having the right supplement or whatever it might be. So whatever your goals are, pretty much guaranteed we can uncover a lot that's going on and where you should direct your attention when it comes to reducing your risk of cancer coming back or working on recovering from symptoms, or if you're currently in treatment, helping you get through treatment a little bit better, if we can look deeper into your blood work. So that's what I'm going to do on this blood work live bootcamp. You can learn more over at flourishaftercancer.com/bootcamp, where I'll have more details and you can sign up for that as well. So I hope to see you there. So I just wanted to give a little bit of information about that because it's very exciting. It's happening soon. Today, though, we are going to talk about inflammation. And I really want to teach you about what is inflammation and how it ties into cancer and how can we manipulate and understand more about inflammation and make a difference when it comes to choosing better strategies for you to stay cancer-free and to feel better as well after cancer. Because I know that inflammation is a buzzword. It seems like a blanket term, but it is very important in the realm of cancer because it is a conventionally recognized cancer initiator and promoter. We know that it causes cancer to start and it causes it to grow. And we don't have all of the details. Like, it's not all documented how inflammation starts, or we can't know everything about it and how it causes cancer. But I think we can go a little bit deeper than what conventionally is explored and recognized. So that's what we're going to do today. And just a heads up, if you are watching it on YouTube, I've been having trouble with this light and it's been getting dark really early where I am filming in Washington State. So if my light goes out, I'm going to keep going, even though you might see that you can't see my face as well because it's a little bit darker right now too, even though it's only 3 p.m. But we're going to keep going no matter what. So let's get started here. So let's talk about first, how does cancer start and grow? Because then I'm going to talk about inflammation and how it plays into these 3 keys that I'm going to talk about. But basically, at the core of cancer, there's a problem with regulation because every day your body is making new cells. It needs to repair things because we do damage to our cells throughout the day, from everything we do, like eating to moving. They all cause damage to cells. Our digestion or digestive cells in particular are going to be replaced quite often. And we need to build new ones, make new ones. And more often than that, that's not a problem because our body knows how to make new cells and it knows how to repair some ones that maybe don't need to be replaced, but that they're damaged and they need to be repaired. So our body is constantly making new cells, replacing old, damaged, dead cells, and that's a natural process. And it's also making repairs to a lot of tissues and cells and things like that too. We also are really good at clearing out cells that have been damaged beyond repair. So we actually need to kill them off and package them up and get rid of them. And just looking at things that don't behave normally, because pretty much at any given time, people have cancer like cells in their body, but our immune system and certain processes in our body are good at finding those and saying, you don't belong here, and getting rid of them in a very effective and clean manner. And so those are normal processes that go on every day. And most of the time, those systems work incredibly well, but sometimes there are mistakes that happen. And it's not necessarily just one mistake and boom, cancer. It's usually a series of processes that have gone awry. Your backup systems aren't working. And then eventually, there's so many things that went wrong that we've now got a cancer cell developing. And then that cancer cell goes into a different kind of survival mode where it starts to create more of itself and just basically create more tumor that way. But what happens whenever a cancer develops is usually there's about three, and this is just a very basic cancer biology kind of conversation, but usually there's about three things that begin to happen together over time. And one of them is that, and I'll go through all three. Basically, cells will experience more hits, is what I like to call them. So they're just getting damaged more often than usual. And they just can't keep up the repairs and the replacement. Your body is just like, wow, there's just so much going on here. I have to work over in segment A, and there's so much damage in E, F, G, and I still have to go to B and C before I even get there. There's just so much going on that I can't keep up and cause those repairs to happen due to damage, like a lot of damage to the cells, excessive damage. So that's one is cells experience more hits. Again, you might hear me say hits every now and then in these podcast episodes. Also, there's a possibility that the internal environment will provide more resources for abnormal cells to survive and grow. So there's certain processes might get switched on when they shouldn't be, and that's going to give more fuel and more signals to these cancer cells to kind of thrive and be happy, kind of starts a party. And for some reason that goes unchecked by your body and your body doesn't notice it, and it just kind of goes out of whack. So that's number two. And then the third thing is that the body's own defense systems, like the big one being your immune system, becomes less effective at keeping things in check. So just to repeat that is we get more damage, more hits to the cells, so your body can't keep up. There's a lot of signals or parties going on that are more cancer promoting. And then also we have the own innate defenses that our body has, and there's many of them, but I mainly talk about the immune system. It just becomes less effective. And just behind the scenes of these three particular things I'm talking about, these keys here, is there's dozens, if not hundreds of things that contribute to each one of these particular categories, these keys. So there's a lot that can go on. Usually your body is functioning optimally, but over time, with more exposures to damaging things, with more problems, either genetically, epigenetically, environmentally, whatever it might be, we become more weakened against cancer. And one of the biggest things that's going to weaken these three keys and cause our systems to become dampened in anti-cancer responses is inflammation. So when I say that there's dozens, if not hundreds, contributing to each of these three keys, that's because of our balance and the balance of inflammation in the body. And the thing is, I think you might know this already, and if not, that's okay. Inflammation is not all bad. We do need some inflammation sometimes because it can be very protective. In fact, inflammation, when it's working the way that it's supposed to, it's going to help you to do things like heal your wounds or fight infection. It will help you to recover from illness or injury or adapt to stress or even help to recover after exercise. Your inflammatory response does all of that, and we need it in certain amounts. So short-term inflammation, it has a very, very beneficial purpose, and then it needs to turn off. So we need it to do its job at killing the bacteria, the virus. We need to do its job at making new tissue. We need it to do its job at helping us to recover from the muscle damage that occurs with just natural exercise, but then it's supposed to turn off. And the real problem is when inflammation just doesn't know when to stand down. It can't turn off because maybe there's something missing in that process to turn it off, or there's just constant stimulation causing it to constantly have to be on and not be able to turn off because thinks it's trying to help you. And that's whenever inflammation becomes chronic, it becomes low grade. It turns from protective, becomes more cancer promoting, which is the real problem. And instead of helping the body to recover, it will hit these three keys in bad ways. It will basically disrupt normal repair and regulation because your body's so busy trying to fix damage or fight off viruses or recover from stress that it's distracted and it might not have enough time, energy, I don't know, whatever you want to call it. It doesn't have enough attention to give to helping to repair any of these broken, damaged cells that then get the opportunity to change into cancer. The other thing is that inflammation can contribute to a pro-cancer environment. It starts to feed cancer because it starts to send more pro-inflammatory signals. It gets confused. It thinks it's helping you, but instead it's secretly feeding cancerous processes, encouraging the cancer cells to grow and to be fueled and to spread, because that's what inflammatory signaling can do sometimes in excessive amounts. And it also drains the body's defenses against cancer. So it, again, will send the immune system to do jobs that it necessarily doesn't need to do. And it's a distraction. It's kind of making your body it doesn't have enough personnel to man the stations that it should typically be manning, basically, or womaning. So over time, it just creates conditions where the body has trouble. It has trouble finding these abnormal cells. It can't repair them anymore. And it just can't keep this state in your body where it's an environment where cancer just doesn't want to be. So I just want you to know that inflammation does have some benefit, but it's a matter of striking a balance between these anti-cancer and pro-healing states. So the goal isn't necessarily to completely 100% eliminate inflammation. In fact, it's not really possible unless you had like so many genetic things knocked out in your body. And I think you'd be living in a bubble at that point. But in some inflammation's okay sometimes because I have some women who are like, they're this is a common thing actually, is we have women go get their inflammatory markers tested on blood work, and usually they're post-treatment. So there's a little bit of nuance here to testing someone's inflammatory markers in treatment or post-treatment. But they're post-treatment, they went to get their inflammatory markers and the rest of their blood work done, and they come back like, oh no, my HSCRP is high. And we're like, did you work out before going and get your blood drawn? And they're like, yes, I did. And it was because they worked out, did strength training, whatever it might have been, that raised their HSCRP, which is your inflammation marker. And we're like, that's okay. We're gonna have to get you to get it done again. But just so you know, a little bit of inflammation is normal after exercising, and that's why your HSCRP is high. We want to double check that that's the reason why and have it done not after exercising. But we need some inflammation sometimes because that inflammation in terms of exercise, what I'm talking about now, is actually helping to repair the muscle tissue that's been damaged from the movement and make new muscle tissue, which is a healthy process. We need inflammation. So the goal is to help the body to complete the inflammatory cycle, provide it with what it needs to kind of finish the job and shut down, and then go away whenever it's no longer needed, basically. So some contributors to inflammation that we maybe can and cannot control, and it all feeds back into what can we do to reduce inflammation and therefore help our body to work optimally and reduce cancer risk, is we can control some of these. We can't control them all, but we can start picking away at a lot of them. And we all know that there's environmental influences like smoking, alcohol. And if you didn't know alcohol, it's really surprising. It was surprising to me because this is what I do, cancer this, cancer that. But a lot of people don't know that alcohol is a common cause of cancer. And a lot of it is due to the inflammatory processes that it initiates. I did a whole episode, I believe it's episode, oh no, maybe 23, episode 23 on alcohol. So you can go read more, or listen more about that. But basically, smoking, alcohol, air pollution, we probably all have not all, but mostly a decent idea that these are known contributors to cancer. Also, maybe some lesser known, but kind of theorized in the conventional world anyway, more kind of pushed as we need to look at these things in the functional medicine world. are parabens, phthalates, and other endocrine disruptors. So they can go in and either mimic estrogen or block normal estrogen signaling and create excessive estrogen signaling in some cases. So endocrine disruptors, they disrupt your normal hormonal processes. These are things that are found in our environment, and we can start looking at the products we use, everything from makeup and lotions and even packaging and things like that, and start to reduce our exposure to those pro-inflammatory factors. Pesticides, and dose often makes a poison in a lot of these, but I believe that if we can do whatever we can to eliminate them to near zero or as best as we can, then I think we're really going to be fighting against cancer, which I think is what our goal is if you're listening in. So we got those environmental influences. We can start to look at what do we do every day? What are we exposing ourselves to? And how can we reduce those exposures? Because those exposures lead to inflammation and bogging up those three keys that can contribute to cancer. There's also some more commonly accepted contributors to inflammation, and that would be like poor diet. So you got your processed meats, you got high saturated fats, like these are the commonly known things, excessive carbohydrate or sugar consumption. There's links between these and encouraging more causes of cancer and cancer cases. So if we can start to work on that, that will help to reduce inflammation because at the core underlying message of how all these things lead to cancer is they cause more damage to cells. They prevent our body from healing and repairing things. They create more of a pro-cancer feeding environment in the body. That's what all of these things do. They cause inflammation. We also have like a sedentary lifestyle leads to inflammation. Um, we even have like certain diseases like diabetes, inflammatory bowel disease. People with these medical conditions do have an increased risk of cancer. Again, very basic, causing inflammation. And then we've got viruses like HPV or bacteria like H. pylori. These are known to encourage cancer as well because of their influence on the immune system and inflammation in the body. Other less commonly accepted things that we can consider when we're looking at reducing our risk of cancer by looking at sources of inflammation are like chronic stress, trauma, impaired detox support, particularly after cancer, which I'll get it even more into cancer treatments and what we need to do about that. Simple things like impaired lymph flow, blood sugar dysregulation. You don't have to have diabetes in order to work on blood sugar dysregulation and imbalance. Long-term constipation and diarrhea, they impact our ability to absorb nutrients, causing gut microflora imbalances, causing damage to the gut lining, and all that is underlying sources of inflammation. And then chronic sleep disruption is a problem as well, and it can encourage inflammation. And no, I'm not going to go too far into this, but a big part of it is melatonin is a very important antioxidant. It's very important for sleep. And melatonin being an antioxidant is protective against inflammation. So if we're not getting adequate levels of melatonin on a regular basis, then we're going to leave one of the pathways weakened. We're not going to have a lot of defense against cancer promoting damage to cells. There's so many ways to cause damage. Melatonin and sleep is important for your overall health, but I don't want you to lose sleep over losing sleep. I think it's something to consider and something to think about how can we work on this and then start working on it. I don't think that just missing a couple of nights of sleep is going to lead to cancer right away. That's not how it works. But if we got chronic sleep disruption, we got bowel problems, we've got a history of pesticide exposure, all those kind of things, that's the compounding effect that leads to a lot of these processes in your body breaking down and encouraging cancer to start and grow. Okay. So a lot of these all are things that we can look at, explore more. There's more than this. These are just kind of some more common ones that we consider when we're working with our flourishers in the roadmap to recovery. And all of these can lead to damage. They create more inflammation in the body. They bog up our body's own defense mechanisms against cancer. So even though we like to believe in the conventional medicine world that um, we're not responsible for a lot of these things. Like we can control and that we can't control a lot of it. I think there's a lot we can do above and beyond what's typically talked about. And I don't mean this in a very fearful way. I hope you're learning more education. And I want you to think of this as like exciting. Like knowledge can be exciting. And I can't remember if I've talked about this before, but it's not doom and gloom like, holy crap, I have to go do all of that. How is that ever going to happen if I don't do it today or this week? Then I'm causing cancer. Like, what am I going to do? No, it's like, oh, that is so awesome. I've got some power and some influence here over what I can do. I'm going to start with these two things. I'm going to give it a go for a good solid month, see how that works. Doesn't work, I'm going to change it so that it does work. And then I'm going to move on to the next level of support too. This is the only way that health changes are going to really work and stick. This is the only way, not the only way. I hate to be very black and white here, but this is a strong way to help start reducing your risk of cancer coming back without approaching everything like it's going to bite you in the butt, basically. So let's think of it more exciting. There's that fine line between excitement and fear a lot of the times. And I want you to push more towards excitement and having new knowledge and going after it. Okay. So let's talk now about cancer treatment. And this is because I I think it's just not appreciated, it's so underappreciated how important it is to help people to get through treatment better and to, especially after treatment, heal much quicker and better. There's like no support, right? This is why I have a job. And I sometimes wish I didn't because I wish this was a little bit more accessible and, I don't know, talked about. But when you go through cancer treatment, the point of cancer treatment is to cause inflammation. We want to induce inflammation through chemotherapy, radiation, even surgery sometimes, certain medications, immunotherapy. A lot of these goals of these treatments is to cause inflammation in order to kill the cancer cells. And it's definitely the right time and the place. We do want to kill the cancer cells. And until we get something better than these therapies, this is what we've got. So these treatments are going to cause inflammation to kill cancer cells, and then we just expect the body to be able to turn that off afterward. When I just discussed how turning off inflammation is often a problem leading to chronic inflammation, causing people to develop cancer. So, if we're not supporting someone during treatment to turn that inflammation off and help it to not go too past the point of killing these cancer cells, and especially after treatment, if we're not helping people to rebuild their bodies back up with appropriate building blocks and nutrients and whatever it takes to help that inflammation to resolve, we're just causing people to jump from having cancer to potentially setting them up for cancer again down the road. Now, it's a little bit extreme, and I don't want you to be afraid of that, but I'm just so angry that we just don't have more support on these things. So, this is what we do is what we want to do with everyone is we want to help them to get usually the appropriate nutrition to help their body to rebuild all these things, get the right resources, help to diminish inflammation, whether it's supplements and anti-inflammatory supplements or just as basic as proper sleep, stress reduction, cleaning up the environment so that it's not contributing more cancer promoting substances so that it gives your body a break and can focus on what it needs to do, which is to heal that inflammation from treatment. All this is really important to help someone to reduce the risk of cancer coming back. So the other side of this is why women always feel like they're so crappy after treatment and their bodies aren't bouncing back. Or in the case where a lot of people are digging in really hard and changing a lot of things when it comes to nutrition, you might notice that they bounce back a little bit faster. Um, it's like their body is so bent on healing from the inflammation and rebuilding those tissues that have been damaged that weren't cancerous, but they get hit in the kind of big, like they're like bystanders, I guess. They get hit by accident. Then if we can repair those things, then they're going to feel better because their body's shunting so much energy and resources towards repairing these things that you've got brain fog, you've got extra pain, you've got a lot of fatigue. So that's a sign that your body's saying, we are missing something here and we need some help. Can you help me figure out how to resolve this inflammation and rebuild us back up so that we can function optimally again? So, whenever we're looking at treatment, it can have impacts on your healing, your energy, your gut health, because a lot of these treatments, like chemo especially, can target your gut. Stress can target your gut and the microflora, the little microorganisms that grow there. And that can like have an impact on your immune system, energy, digestion, absorption, all those kind of things. Your immune system can get out of whack whenever you're going through treatment. If you have hormone changes, we need to support the organ systems like the liver and the kidney, lymphatic systems. All these things could be supported because they've done a big job trying to process all the medications and the stress hormones and everything that you've pumped through it. And we need to support those systems again. Of course, there's stress. And then not only that is like is there anything, and we can't always get an answer, but is there anything we can do to identify some potential root causes to the inflammation or inflammation and cancer that may have popped up in your life before the actual diagnosis? And can we do anything to change that? So sometimes we'll have women come to us and they had some hormonal issues for years and years, and that could have potentially encouraged more inflammation. Or more often than not, we see a lot of gut problems, digestion problems. Maybe there's even some environmental exposures. Like, it's so sad how often I hear, like, I worked in a school and like 5 out of the 10 teachers I was close to ended up with a cancer diagnosis because whether the water system was contaminated or there was mold or whatever. Like, we never 100% know. I'm not going to say that that's exactly what caused it, but it could be one of those contributors that dampened our own immune responses and cancer defenses, and that caused just problems, hits to cells, things like that. So we can't always get people to change their jobs, but what can we do to help encourage those processes to run more smoothly in their body and control what we can control at home, for example? So we basically want to help people, just to kind of summarize what I just chatted about, is help people to heal better after treatment and then also dig deeper into what were some potential root causes before the diagnosis even popped up. So actually, that leads me into how do we address the inflammation and make a difference? The first step we want to do is measure, and we can do that through a bunch of different avenues. One of them is to do some objective markers, which would be something like the blood work. And again, that blood work boot camp happening very soon. If you're listening in January, you can sign up over at flourishaftercancer.com/bootcamp, where we'll talk more about inflammatory markers like HSCRP, ESR. We want to look at ratios of the different types of white blood cells, and that gives us a bigger insight into, is there inflammation present? Do we have an imbalance? Do we need to support the immune system? Looking at the trends and the ranges, and even like our applications of treatment and monitoring the change over time can give us some more information into, are we actually applying something that's helping too? So those are objective markers. We also want to look at subjective markers. So what are your energy levels? How is your digestion? Sleep, pain levels, brain fog, anything like that. If we can kind of get an idea of how things are, it can help us identify where we might need more support. Like, do we need to support gut health? Is there a microflora imbalance? I talk about that a lot, but it's one of my favorite things is gut health. Um, are there some hormonal issues going on? Then we can kind of mark it on a scale of 1 to 10 or identify the frequency and the intensity of symptoms. And it's also a good tool to use as tracking over time to make sure that your treatment plan is working. Also, just looking at other aspects like the context of, like I was saying, did you work in a school where a lot of people got cancer diagnoses as well? Does it run in your family? Is it more genetics, epigenetics, things like that? Just getting to know you a little bit better helps us to understand more about where we want to focus our attention and if there's any potential inflammation present. So once we do a big look at everything, like basically information gathering, we want to use that information to start applying some treatments. We always want to start with the foundations. So these are kind of like my 6 pillars of cancer recurrence prevention. Nutrition. Let's see if I can name all 6 off the top of my head. Nutrition, movement, mindset, digestion/detoxification. I put them together because they're highly linked. Epigenetics and functional testing. And I am missing one. I'll put them in the show notes. It's hard. I'm a very visual person, so if I didn't type them out, then I don't know which one I've even missed. I'll get back to it. Show notes. Check the show notes for those. But those are the foundations. We don't want to get fancy until we've analyzed all of those foundations, double checked it. Oh, I know what it is. Environmental contaminants. Checked everything. And we want to make sure that those foundations are in place, because we start getting fancy with supplements and like curcumin for inflammation, or um, DIM for hormonal management. Like, they're not going to do anything if you're still exposed to whatever thing in the environment that's in like causing the inflammation to happen, or if it's really your digestion, like you're constipated, which is causing your hormones to recirculate throughout your body. So the DIM's not going to do anything much until we get you having daily bowel movements, because that's how you're going to remove the excessive amounts of estrogen from your body. So foundations, we always want to look there. Some things would be like blood sugar stabilization, restoring nutrients, getting your macronutrients, your protein, carbs, and fats, and your micronutrients, like your vitamins, into you. stress, sleep, all these things are very important for getting these foundations to encourage the proper functioning of the organ systems within your body. Whenever we have proper functionings, we're creating an environment that's not going to be pro-cancer. We're not going to distract the body from having its anti-cancer defenses, the immune system support. And if we're looking at the environment in particular, we're going to reduce the number of hits to the cells that can lead to cancer, bringing you back all the way to the beginning with those 3 keys. So foundational approach can address those 3 keys. Then we can go a little bit deeper. We can get into more testing like metabolic dysfunction, mitochondrial health, immune dysregulation, go even deeper than some blood work in a CBC and go into all the different types like natural killer cells and different types of T and B cells and things like that on fancy test kits. These we can go a little bit deeper sometimes, get a little bit more targeted towards specific supplements to kill off some bacteria in the gut that we don't want to be there and to reseed with the ones that we do want to be there. That's like a next level approach for sure. So overall, the process is pretty layered, but it all comes back to targeting those main 3 keys in order to decrease inflammatory burden, in order to let your body to do its thing and to go back to finding and fighting cancer cells before they become a problem. Okay. So none of it happens overnight. I want you to look at this information as exciting and not foreboding. Would that be a good word? Because you really can't do it all at once. And in fact, whenever you have your data in place through looking at your objective markers of your blood work and your subjective markers of looking at your full picture of health and kind of analyzing it with scales and measurement systems and literally just talking it through, you find that there's a lot of things on there that actually look pretty darn good. And you don't even need to spend your time there, which is fantastic. Sometimes just having information can be very calming. And I don't want you to overlook that part. Sometimes we get people's blood work back and it looks amazing. And there's nothing you necessarily need to focus on when it comes to your blood work. So then we get harder into the foundational work and explore those options a little bit more. And I wish people were more excited when things come back wrong or right. Because whenever things come back wrong, it feels like you can make a difference, right? And there's something you can focus on and you can start working on it because pretty much anyone who's following me is very excited to take action and take responsibility over their health. And I know that's what you want to do. And sometimes it can be frustrating when you don't know where to go still from your blood work, but you should also celebrate it because that means that at that level, things are looking great. And then maybe we want to dig a little bit deeper with specific functional testing, but a lot of the times we do that, but we also want to make sure that you are in a space of calm and you're working on your foundations as well. And consistent long-term habits for formation is what we're looking at there. So that is all I have for you today. Final reminder, I would absolutely love to see you there. Blood Work Clarity Live Boot Camp. It is January 22nd, 23rd, 26th, and 27th. I think those dates are right. If not, it's on my website, flourishaftercancer.com/bootcamp to go check it out. There is a VIP option as well that you can add on. This is a paid boot camp. I have a lot of free information, but this one is going to be paid. And the VIP option, if you want to add it on, is all about getting more in depth. So the basic core option is all about the information and learning the processes, getting the handouts. And then the VIP is where you actually get to sit in on sessions with me. You can even submit your blood work for my review. I'm going to review it in front of everyone so that you can see it actually in action and ask any additional questions that you would like to have answered after listening into the core session there too. So all that information, flourishaftercancer.com/bootcamp. Thank you so much for hanging out with me. And here's to you flourishing after cancer. Thank you so much for joining me today on the Flourish After Cancer podcast. If you loved this episode, please be sure to leave a review and subscribe so you never miss an episode. Sending all my best your way, Dr. Megan.